And welcome everybody to our latest webinar series. For those of you that normally join us on Zoom, you'll know that we just need to hang fire for 2 seconds while we wait for Facebook to catch up. Anyone who joined last week knows that we had a little hiccup, but it's all in hand tonight. So we have Facebook joining us tonight. So welcome everybody from Zoom and Facebook. And as always, we are so pleased to see so many of you attend these live webinars. And we always ask for you to continue to support Wild Horse Welfare and ultimately horse welfare in many ways. But one of the really easy ways you can do this is to encourage your friends and family to attend or watch these webinars back as well. So we always feel that Zoom is the best way that you can take part in these webinars, and anyone can register for free. You can also watch it live on Facebook, or if you can't make it on the day, you can subscribe to our YouTube channel and watch back at a later date. And I think Basil should be able to pop the link to our YouTube channel in the chat. So I'm sure you all know, but tonight we're really excited to be talking about all things to do with managing equine gastric ulcers, and we're really pleased to welcome vet David Rendle to talk to us about that. I'm also going to take this opportunity to give you a bit of information about our next webinar, which will be on the 13th of March, where we'll be joined by Dr. Emma Lethbridge to discuss trauma in horses. And Emma will be joined by equine behaviourist Justine Harrison to answer any questions. So that's on the 13th. Finally, we're going to be back to our Wednesdays on the 13th as well. As always, we want you to be involved in so this is a two-way conversation. So there is, for any of our Zoom users, you'll see that there's a Q&A tab on the bottom of your screen. So use that tab, please, to post any questions you have for David. You can put them in as he's speaking or as the end, we'll get to them at the end. And if you're watching on Facebook, you can use the comment section to ask questions and share your views on that as well. If you enjoy today's discussion, which I'm sure you will, then obviously let your friends and family know. And we do welcome ideas for future topics. So please let us know on the chat or on email. So the email is education@wildhorsewelfare.org. So I'm just going to share my screen with you for a second, because we're going to do a quick poll question. So I can share. Let me put that into full screen so that everyone can see it. So the poll that we have for you all tonight is, have you had or do you have a horse that has been diagnosed with gastric ulcers? So for those on Zoom, that poll question should be popping up any second. And if you're on Facebook, you can't take part in the poll, but you could always pop your answer into the comment section if you want. So while you're completing the poll, I will quickly introduce David to you, which I'm sure many of you know already. So David graduated from the University of Bristol in 2001 and then completed an internship at Liphook Equine Hospital. He trained as a specialist in equine internal medicine and had a master's in research into equine asthma and then an RCVS certificate in equine medicine. He was the director of Rainbow Equine Hospital in Yorkshire before returning to West Country Roots in 2020, where he now works as an independent equine medicine and therapeutics consultant. He is a former BIVA president, chair of their Health and Medicine Committee, Canter Veterinary representative, and also sits on a British Equine Advisory Group. And in his spare time, which he did say he doesn't have much of with 2 young children, he does like to play cricket as well. And I feel like I only caught half the story, but he was once dressed up as a fisherman at the Oval, I think. But that is a story for David to share when he's ready. So let me stop sharing my screen for a second now. Before I pass over to you, David, we're going to quickly see if we've got those poll results in. If Basil can work his magic. So we've got almost 60% of our audience have had experience of gastric ulcers. And nice to see a quarter haven't, and another almost 20% is think they might have, but they haven't been formally diagnosed. So I'm sure you might cover some of that in your presentation, David, about what signs we might expect to see as well. So welcome, David. Thank you very much for joining us. And I'll pass the reins over to you now. Don't know if you want to share your screen. Oh, you're on it. Perfect. So I'm just going to mute myself, and that looks great. Off you go.
Brilliant. Thanks, Lana. I may not share details of the previously mentioned story that was for private consumption, but anyway, equine gastric disease. Yeah, interesting that so many of the audience, I suppose perhaps not surprising that people are tuned in that have had a horses with a history of gastric disease, but we do know they're extremely common. If you've had many horses for any period of time, it would almost be amazing if you hadn't had a horse with gastric disease, whether or not it's been diagnosed. So it is a huge welfare issue that we do need to do a much better job of managing. So thanks very much for the opportunity of talking about it tonight. So forgive me if I teach you some stuff that you already know and share some information that is obvious to the more experienced, knowledgeable horse owners. But I think it's important we do go back to basics and just understand exactly what we're talking about. The horse's stomach is quite unusual in that it's actually two organs in one. The top part of the horse's stomach, the squamous portion, is actually more like an extension of the esophagus, the food pipe. And that's got a squamous kind of mucosa, whereas the bottom portion of the stomach is like our stomach. It's got a glandular mucosa, and that's what we call the glandular portion of the stomach. So there is a clear line through the middle of the stomach, which we call the margo plicatus, which demarcates the change in anatomy and physiology. So it's really odd that we do have almost two organs in one in the horse's stomach. Those that have seen gastroscopy pictures, so looking down with a camera, this is what we're looking at. You see the squamous mucosa, the squamous portion of the stomach at the top there, a very white coloured mucosa, just like the food pipe, same as ours. And then the glandular portion of the stomach, where we've got acid producing cells and lots of glands producing mucus and other substances. And it's a very, very different appearance. It looks very similar to our stomach, and it looks very similar to the horse's intestine. And that clear line between the two, you can see, is what we call the margo plicatus. So we're trying to move away from the term gastric ulcers because they don't always describe what we actually see. We now try and talk more about equine gastric disease, and we split that into squamous disease, so disease of the squamous portion of the stomach, and glandular disease of the glandular portion of the stomach, because those two are quite distinct. There is quite a lot of crossover, and there are similarities in how we manage those two different diseases and how we treat them medically, but there are also fundamental differences in how and why they develop and how they're managed. So it's important to differentiate them, and that's one of the biggest reasons for scoping horses, is to actually identify whether they've got squamous or glandular disease. Gone should be the days of just talking about gastric ulcers as a whole and managing every horse the same. So I made the point at the beginning that unfortunately many of us have had horses with gastric disease, and this graph, I think, illustrates how common gastric disease is in different populations. It's a slightly old slide now, and there have been more recent studies, but they still give you the same overall message. If you just look there at the numbers, there are percentages, and the white bars are squamous disease, and the darker blue bars are glandular disease, and then along the bottom you've got different types of horses doing different types of jobs. But there's not many there, with the exception of one study where we had 11% of horses that were just happy hackers. I say just happy hackers, nothing wrong with that were happy hackers. There's been other studies that have shown a higher percentage. You struggle to find any study really of any number of horses where you're finding less than 30 or 40% have got gastric disease. And you'll see there in some populations, if we're looking at race horses in training or endurance horses in training, it's much more like 80 or 90% that have got squamous disease, certainly. And then a lot of competition sports horses will have 50 or 60% of them will have glandular disease. So horses that are competing and working hard, it's comfortably more than half that will have gastric disease. So clearly that is a welfare concern. So what are the signs of gastric disease? I'm sure these will be familiar to many. Poor body condition, that tends to be unusual. They've got to be pretty severe and pretty extreme for horses to be losing weight as a consequence of gastric disease. Wind sucking and crib biting, there's a bit of a chicken and egg there. I don't think we fully appreciate whether or not it's the stereotypical behavior that's causing the gastric disease or vice versa, but it's not a consistent finding, but there has been an association between those behaviors and the presence of gastric disease. Horses that are girthy, so if they resent having the girth tightened up or they resent pressure around the girth region, that can be a sign of gastric disease, but it can also be a sign of many other things as well. Weight loss, a bit similar to poor body condition. It's got to be pretty severe gastric disease to be seeing weight loss, so that's quite unusual. Change in rideability sounds a bit of a nondescript term, but it's quite a good term in some ways, particularly for horses that have got glandular gastric disease. Riders just notice a change in how well they perform and how they go, and it's hard sometimes to be more specific than that, but it just affects their ability to work and the comfort with which they work, and that may knock on to reduce their willingness to work, obviously. So potentially just a reluctance to go forward. Appetite may change, their eating patterns may change, their appetite may change, their preference for different foods and the way they go about consuming their food can change quite subtly, which some owners will notice. Their behavior may change, understandably. If they're in discomfort, they may be dull. Some of them will have sensitivity over their flanks, a bit similar to girthiness, but they may resent leg pressure when they're being ridden. They may resent any kind of touching or brushing over their flanks when they're being groomed or rugged up. And then just general changes in behavior that are often quite hard to pin down, but owners will notice that their horses are just different because they've got this abdominal discomfort. And again, colic, potentially, we don't see it so much these days, I don't think, where we tend to have gastric disease under better control, but really severe gastric disease can be associated with colic. Obviously, we suffer from heartburn, which is similar to squamous disease in horses. Those people that have had it know it's uncomfortable. It doesn't tend to generally cause the severity of pain that we would associate with horses having colic, but really severe ulcers can cause horses colic, but not very common. Dull hair coats sometimes, they just look a little bit off, but there can be 101 different reasons why that might be too. So just like many of these clinical signs, it's not that specific. So loads of different concerns that might lead you to suspect gastric ulcers, and lots of those different clinical signs could be caused by many different things. So we need to try and diagnose gastric disease and come up with a definite answer for you as to whether or not horses have gastric disease. The horse's stomach is predominantly on the left side, predominantly behind the rib cage. So it's not the easiest thing to look at. We can't X-ray it effectively. We can't ultrasound scan it effectively. The only way we can do it to accurately identify gastric ulcers is to put a camera down and have a look in the stomach, and that's the process of gastroscopy. People have tried all sorts of different ways of doing this because it's not nice putting a camera into a horse's stomach. To be honest, it troubles them very little. They're sedated and they tolerate it extremely well. So it's not a procedure that you ought to be discouraged from doing at all. They really don't mind it. But still, it's still putting a tube into a horse's stomach, and if we could avoid that, that would be great. So people have looked at other options, but they just don't work, unfortunately. There aren't any blood tests that are reliable. There aren't any fecal tests. There are tests commercially available, but none of them are reliable in diagnosing gastric or, for that matter, intestinal ulcers. Other less conventional ways of diagnosis, so pressure points, psychic media, there's no evidence that they work. It's very easy to diagnose a horse with gastric ulcers, and odds on you're going to be right in some situations because the majority are going to have them, but you can't reliably, unfortunately, diagnose gastric ulcers with anything other than gastroscopy. Saliva tests have been in the media recently. There are slight differences in populations that do and don't have gastric ulcers, but you can't use those tests to accurately identify individual horses that have gastric ulcers, unfortunately. And even if you could, none of these things are going to tell you whether they're squamous or whether they're glandular. They're not going to tell you how bad they are. So they're not going to give you the best idea of how you go about treating them. Mobile gastroscopy is increasingly common now, and has been for some time. I'm sure everyone's familiar with vets coming out to the yard to perform gastroscopy. The days of this being done in a hospital are long gone. Most vets will be very comfortable doing this out and about these days. So it really is a very simple and safe thing to do if you are concerned about your horse having gastric ulcers. So we keep saying they're common, keep saying they're a welfare concern, but why is that? Why do they develop? Well, essentially because we take horses out of their natural environment. We manage them very differently to the way they've evolved to live. If we track back to where horses have come from, they've all come from grazing on pastures that are unimproved. They're quite sparse generally. These horses normally ferment low quality fiber in their hindgut, in their colon. They come from desert regions and mountainous regions. They don't live as we tend to keep them now on improved, formerly farm pasture with lots of mod cons. And that fundamentally changes how their stomach works. So domesticated horses get fed lots of cereal. I'm generalizing, but they often get fed cereals or grain-based diets. They will potentially be kept confined and not be freely wandering as they would have done originally. We obviously compete them and work them, which is quite alien to how they evolved. We will potentially keep them on their own, away from their buddies. We will rug them up in the winter and look after them. Not necessarily a bad thing, but it does come with some concerns, and we will transport them as well. So all of these things are alien to how they've evolved, and all of these things have the potential to increase the risk of gastric disease, with a possible exception of rugging them up. But that has other potential issues of promoting weight gain, which can in turn cause other problems. So slightly technical. If we look at the horse's stomach, the horse's stomach should have a nice layering of its contents. So down at the bottom, it'll be quite liquid, and it'll have a really low pH, so it'll be really acid. And then as we come higher up the stomach, we'll go through different layers, which become more fibrous and become more alkaline. And the bottom portion of the stomach, that glandular portion, is well equipped to cope with a really low pH, high acid environment. The top part of the stomach is not designed for that. That is just an extension of the horse's esophagus, and it's not designed to cope with constant exposure to acid. So a lot of the things that we do in our management of domesticated horses increase the potential for damage to that squamous portion of the stomach particularly, but also to a slightly lesser degree the glandular portion. So if we're feeding less fiber, which we often are in a natural situation, we're supplementing other foods in, and we're not allowing horses to constantly graze low quality forage. If we do that, we get less of that normal layering. We will see a lower pH higher up in the stomach, so more acid exposure to the squamous mucosa. If we're feeding less fiber, we're also stimulating less saliva production, and saliva is alkaline, so it buffers the acid, neutralizes the acid at the top of the stomach. So we lose that benefit if we're not feeding lots of fiber. And if there isn't that physical mat of food in the stomach, we get a lot more mixing and splashing of the contents of the stomach. So that highly acidic fluid from the bottom gets higher up the stomach and can cause splash injury from acid exposure. If we're feeding more cereals rather than fiber, then we are potentially stimulating more acid production through the production of gastrin. So cereal-based foods stimulate this hormone called gastrin. That in turn stimulates more acid production. And if we're exercising horses, exercise is a good thing, don't get me wrong, particularly when we're talking about obesity and laminitis. So I'm not discouraging people from exercising their horses, but it does potentially increase acid exposure to the top portion of the stomach and reduce blood flow to the stomach, which can be injurious to the stomach. So exercise, whilst on the whole is a good thing, does increase the risk of gastric disease, particularly if it's done over a long duration. So let's look in a little bit more detail at the two different types of gastric disease. If we take squamous disease first, which is the one we've traditionally been more concerned about and more aware of because it's been easier to identify at the top of the stomach. Squamous disease, often shortened to equine squamous gastric disease, or ESGD. This is the squamous mucosa that you've already seen. This is grade 0. This is nice and normal. We grade it 0 to 4 when we're looking at horses' stomachs. This will be grade 1. So we've got some what we call hyperkeratosis there. So some slight thickening of the mucosa, keratinization of the mucosa, and that often comes with this yellow bile staining. So that's not, the mucosa is not being ulcerated, which is why we don't always talk about this term ulcerated anymore. It's not gone through, it's not broken through, but you can see it's not quite normal. Grade 2, we do start to see little breaks in the mucosa, so little ulcers when we're talking about the squamous mucosa. And grade 2, they're always quite small and quite localized. If we get to grade 3, we start to see more extensive damage to the squamous mucosa. And then grade 4, we get extensive lesions and areas of deep mucosal damage as well. So these lesions do start to get sore quite often. But it's also remarkable how well some horses will have quite severe gastric lesions and not show any clinical signs at all. So risk factors for squamous disease, if we're looking more specifically now at just this squamous portion of the stomach, but this reflects a lot of what we talked about with the more general risk factors. Risk factors for squamous disease: low fiber diets, low forage diets for all the reasons we've just discussed, high grain diets because of that gastrin stimulation, absence of turnout because they're not getting so much access to fiber. They're potentially more stressed. Absence of horse contact is probably a stress thing again. Daytime feed restriction in the natural situation, horses will be eating all through the day and then fasting for a period overnight. Restricting feed during the day increases the acidity of the stomach and increases the risk of squamous disease. And I don't think anyone would do this voluntarily, and lack of access to free access to water also will potentially increase the risk of squamous disease. And there was one study that showed that talk radio, as opposed to music radio, increased the risk of squamous disease. That's not been a consistent finding, and I wouldn't necessarily change your listening choices just based on that one study. But it was a slightly quirky result that came out of one study in Australia. Treatment for squamous disease. Management. Like, vets are involved in the treatment, but it's what you guys do that really makes a difference, not what we do. We need to try and eliminate those risk factors. Not always possible, so we need to mitigate them as best we can and reduce the risk of injury to the stomach. So look at the diet, try and feed a much more natural, high fiber, low cereal diet. That isn't always going to work. And particularly when you've got disease that's established, you are going to want some veterinary assistance. And we will administer drugs to suppress the acid in the stomach. And they're very, very effective. Sometimes less for squamous than glandular disease. We will also look at buffering or lining agents. They're quite popular with horse owners. There isn't, unfortunately, evidence that they really make much of a difference. Again, more for glandular than squamous disease, but sometimes we use them. And again, they're popular in some of the supplements and nutraceutical products, things that theoretically stimulate blood flow. But really, the effective treatment is suppressing acid production. And increasingly, we tailor that treatment to the individual. Everyone used to get treated the same when we only really had one drug that we thought was effective. But increasingly now, we're looking at the lesions that are present. We're looking at the type of horse and the management and what you as owners can achieve in terms of management and fasting prior to treatment. And we're tailoring treatment to suit the horse and to suit your situation as well. So what medications have we got? I'm just going to make the point again. Medication is not the answer. Medication helps and it can get you out the hole. But for long-term improvements, we've got to have changes to management and feeding regimens. But acid suppression, the drug that most people will be familiar with is the registered drug, which is omeprazole. The oral pastes are the ones that most people are familiar with. They're the registered products. Increasingly, though, in the last 5 years or so, people have been using a long-acting injectable preparation of omeprazole, which has been shown in a number of studies to be more effective. But the paste is effective in the majority of cases. 70 to 80% of squamous lesions, this is in racehorses, most of the studies have been done in racehorses, will heal within 2 to 3 weeks. But the injection is more like 90 to 100%, but does come with a risk of an injection site reaction, albeit a very small risk. Esomeprazole is a newer generation proton pump inhibitor, so it's from the same family as omeprazole, but it's a newer drug. It's one we often use as humans. It's much more popular than omeprazole for humans. In human medicine, there's been an evolution in different proton pump inhibitors. With equine medicine, until recently, we just stuck with omeprazole, which was one of the first ones developed. But esomeprazole is becoming more popular with some vets. It is a very effective alternative. And then there are other things that might have some minor benefits, but from a medication point of view, the additional treatments don't add a huge amount over the proton pump inhibitors, so omeprazole, esomeprazole. And it is really hard to know which horses are going to benefit from treatment. 70 to 80%, sometimes higher depending on what drug you're using, will improve within a few weeks of treatment, but there's always a few that don't improve. And we often think we can predict which ones those are going to be because of their temperament or their management, but sometimes that doesn't hold true. And there's a lot we don't understand about the response to treatment of gastric disease. So yeah, it is tricky to choose which ones are going to improve. And frustratingly, the improvement in the appearance of their stomach doesn't always correlate brilliantly with their improvement in clinical size. Obviously, clinical size is the more important thing, but it is frustrating as a vet treating some of these because they just don't seem to do what you expect them to do all the time. And what we have come to realize is that the severity of the lesions doesn't necessarily determine how likely or otherwise they are to improve or to heal. Quite often, the horses that have got the worst lesions will improve the most. They will come forward in leaps and bounds, but it can be difficult sometimes to get those last little bits of healing. So yeah, there's a lot we don't understand about why some horses heal well and some don't. There's different oral omeprazole products available. When you're using them, you've just got to be careful with how you use them. These drugs are really expensive. We all know that. It frustrates all of us what they cost. So make the most of them when you're using them. Bear in mind, the drug has to get through the stomach for it to be able to work. It doesn't work in the stomach. It works by getting into the bloodstream and then going around the bloodstream, back to the stomach, into the cells in the lining of the stomach, and blocking the acid production. It doesn't work in the stomach. So it's got to survive that low acid environment before it can do any good. And that's why we use the equine products, and we don't just use human products, as well as the legal reasons. The equine products have been specially formulated to get through the low acidity in the stomach, and to allow them to work. So the way they're formulated is essential for their efficacy. People are often tempted to use human drugs. Some people even import them from overseas, some of these cheap alternatives. They're not going to be formulated, generally speaking, in the same way. So they're not going to be as effective. And if you are importing them, it's also illegal. That's a safety reason, because there's no quality assurance. So an overnight fast is important as well as choosing the right drug to make sure it gets through the stomach. It's important that the stomach is empty of food to allow as much of the drug as possible to get through. And this is an animation done by someone much cleverer than me, a colleague in Australia, but it just shows that to get the most out of our omeprazole drug, we don't want huge amounts of food in the stomach. I know it seems counterintuitive to be withholding food, but if we do it in the nighttime, the horses have evolved to do that, and that's absolutely fine. So we want a period of fasting prior to giving the drug. So if we don't have any food in the stomach, then the drug is much more freely able to get through. It doesn't bind up with the fiber content, so it can get around to the bloodstream, and it can turn off those acid pumps. So we tend to try and withdraw feeding late at night, and then give omeprazole early the next morning, and then don't give any forage until a couple of hours after you've given the omeprazole, to allow the stomach to empty. So just to reiterate, we try and administer omeprazole on an empty stomach after a minimum of an 8-hour fast. Make the point again, it always worries people, and I know compliance with this is sometimes not great, because owners don't like to deny their horses fiber overnight when everything else we're telling them is to make sure they've got constant access to fiber. But honestly, it is in their best interest to just withhold that fiber overnight. It doesn't result in a risk of ulcers. If you were to fast them during the day, that would be a problem. But fasting them from 10 o'clock midnight is not an issue. And it does take time to medicate horses properly, particularly if we're prescribing multiple treatment options, and that's sometimes why people go for the unregistered injectable alternatives. If you can't manage the fasting routine, and then giving the drug and then waiting a little bit of time before you give them fiber, then it may be better to go for the injectable, because that isn't influenced by food in the stomach, obviously, because we're giving it straight into the muscle and then it gets absorbed into the bloodstream. So it's an easier way to get it into the bloodstream, and it only gets done once a week, which is a lot easier. Some people I know struggle to medicate their horses with paste every day, when it's often for a month or even longer. I think it's really important. People often want to give the treatment and they don't necessarily want to go to the cost and the expense and the hassle, and I can understand why, of repeating the scope a few weeks later. But it really is a valuable thing to do, because it's so hard to predict how horses will respond to treatment and which ones will cure and which ones won't. There is a lot of merit in following them up a few weeks later. You don't want to be spending all this money on treatment and then not doing the job properly and not getting the desired result. So prevention, a lot of this is becoming a repetition, because it's the same as the management things that we've been advocating, and we're just trying to reverse those risk factors. So if we know denying horses constant access to forage is a risk factor for gastric disease, then what we've obviously got to try and do is give them free access to forage and water where we can. But we've got to be cognizant that we're also often struggling to prevent these horses from gaining too much weight. So there is a balance to be struck, and there are strategies for feeding low quality forage trickle fed through the day that can allow them to have constant access to fiber and forage, yet not have too much access to calories and weight gain. If you can't allow free access, then try and make sure they're getting a minimum of 4 to 6 meals per day. A little bit technical perhaps, but they need at least 1.5% of their own body weight in dry matter of forage for optimal gut health. Now, again, sometimes there's a balance to be struck against obesity and laminitis, and we as vets will sometimes come down below that level for a short period of time for weight loss. So that's not a hard and fast rule, but that is a general guide that they need at least that much forage for gut health. And the pH of the stomach tends to be lowest in the morning. So try and make sure that they've got access to palatable hay and roughage in the morning, and then hopefully through the rest of the day. Something that often gets overlooked is that horses are better off if they've got some fiber and some forage in their stomach before they exercise. That seems like an alien concept. We don't want to fill them up before we exercise them, but we're only talking about 2 or 3 liters of chaff or hay or something, just to make sure that we get that normal layering in the stomach. And again, this animation from a colleague in Australia shows that. If we've got a horse exercising with an empty stomach with no forage in it, we get a lot of splashing and we get the potential for ulcers. If we put fiber in the stomach, we get that more normal matting, that more normal layering. We also stimulate blood flow, which reduces the degree of splashing up onto the squamous mucosa and reduces the risk of squamous gastric disease. So try and give them a couple of liters of chaff before exercise. That's not going to do them any harm at all. Try and eliminate cereals. A maximum of 1 gram of cereal per kilogram of horse. But the vast majority of horses don't need any cereals at all, unless they're competing at extremely high intensity exercise regularly. So at elite level, they're really not going to burn enough calories that they're going to need cereals. If they do need extra calories beyond hay and a ration balancer, which is unusual, but if they do, then oil is a much better way of giving it than cereal-based foods. There's a massive industry producing cereal-based feeds for horses, but the indications for them are really, really few and far between. We just don't need to be spending nearly as much money on cereal-based feeds as we do. Try and reduce the duration of exercise. Intensity of exercise is less of an issue than duration. Obviously, both together is the worst case scenario, but try and reduce the duration. So if you've got horses that are prone to gastric disease, squamous gastric disease, and the same is true actually of glandular disease, then think about how long they're exercising for. Try and get the most out of your periods of exercise without protracting that exercise too long. So aim for short duration, high intensity exercise to get horses fit, rather than just loads and loads of protracted exercise. And I can't give you hard and fast numbers on how long it should be. That's something to discuss with your vet, with your individual horse, because clearly there are going to be differences, and there's obviously a balance to be struck with what you want to be doing with your horses. I think it's humbling that 90% of racehorses in training will get a recurrence of squamous disease within 2 months of stopping treatment. So hopefully that reiterates the point I made, that we as vets can help you in the short term, and in the majority of cases we can get cure of squamous disease relatively quickly. But if we don't change the underlying management, the majority of horses are going to be back where they were within a couple of months. And this is why so many racehorses and other elite competition horses are on omeprazole or esomeprazole every day through the competition season, which clearly we don't want them to get gastric disease, but it would be fabulous if we didn't have to give them drugs every day. But it is, unfortunately, this is a disease of domestication and a disease of management. And if we don't fundamentally change management, sometimes it is a problem we have to live with, rightly or wrongly. Promote contact with other horses to express more normal behavior, and horses in a rural setting tend to do better than an urban setting. That's less of an issue in the UK, but in other parts of the world, a lot of racehorses are kept in quite urban situations where they don't have free access to the countryside, which I know sounds odd, but that is how it is in some parts of the world. Okay, so that was squamous disease. Let's look more specifically at glandular disease, that bottom portion of the stomach, which is more like our stomach. So it's more analogous with the gastric diseases that we potentially get. So often shortened to equine glandular, equine glandular gastric disease, often shortened to EGGD. So these are the kind of lesions. I won't go into them in detail, but just to make the point that they look quite different from the squamous lesions that we see. Different portion of the stomach, we tend to see a lot more hemorrhage, a lot more fibrinous suppurative inflammation, rather than just breaks in the mucosa. It's quite rare to get true ulcers in the glandular portion of the stomach, which is why we talk about disease rather than ulceration. But here we go, little areas of hemorrhage and inflammation. Those white areas there where we've got inflammation of the mucosa. We often get these little nodules. We don't really understand these very well. Some of them are little polyps, little adenomas, and they can be really, really annoying to treat. But a whole different range of appearances in this portion of the stomach. So risk factors. There's crossover here with squamous disease, but with glandular disease, stress is a big thing, whether it's physiological stress, so induced by exercise, or whether it's psychological stress. So horses that are constantly stressing and fretting and worrying about life. In some studies, an increase in the number of riders and handlers has been shown to be a risk factor for glandular disease, and we assume that's related to stress, horses not feeling relaxed and comfortable with the person that's looking after them and riding them. Exercise is a risk factor again that diverts blood away from the glandular portion of the stomach and renders it more at risk of injury. And in some studies, horses in some disciplines are more likely to get disease if they're exercising more than 4 times a week. Warm bloods seem to be predisposed. Not really sure whether this is because warm bloods are used for certain sports or whether it is a true breed predisposition. Treatment. Much the same as squamous disease, or fundamentally much the same as squamous disease, and that we need to suppress the acid to allow the mucosa to heal. We don't think that these lesions are primarily caused by acid injury. We think it's a breakdown of the normal defense mechanisms of the mucosa. But the best way to allow those defense mechanisms to reestablish is to get rid of the acid and allow the mucosa to repair. So oral omeprazole paste is not very effective. It was designed for treating squamous disease. We've used it for years for treating glandular disease. But the studies that are out there typically show around 25–30% of lesions will heal after at least 4 weeks, and often it's 8 to 12 weeks. So increasingly, we look at different strategies for treatment now. Some people will add in sucralfate to omeprazole as well. The evidence for that is not great, but lots of people think it helps. But there are some newer treatments that, generally speaking, are more effective, and our evidence base is growing, and it needs to grow a lot bigger than it is at the moment. But esomeprazole again, so a newer generation proton pump inhibitor, that is more effective at suppressing acid, and it does seem to be more effective in managing glandular disease. And then, as we mentioned earlier, we can give omeprazole via the injectable route once a week or once every 5 days. And that's much more effective at suppressing the acid than the oral paste treatment. Misoprostol is a drug some people might be familiar with. We use that for a few different things in veterinary medicine. We use that in glandular disease to try and promote normal mucosal barrier function, possibly to suppress acid, although I think it's questionable how effective it is at suppressing acid, and probably primarily to stimulate blood flow to the stomach. The evidence for that is a little bit mixed, but it's often a drug that we'll turn to if acid suppression on its own isn't working. With the exception of oral omeprazole, though, none of these treatments are actually licensed or registered for use in horses. So we're often using our discretion to prescribe things that are not registered for horses. And again, I just make the point, particularly with glandular disease, it's very, very hard to predict how these lesions are gonna heal and which treatment is going to be most appropriate. So it is really important to rescope them to make sure that whatever treatment you've been prescribed is actually working. Oral omeprazole sucralfate is popular. I say the evidence for it is not that robust. One of the challenges with using this combination, and if it's a combination you are using, you just need to think about how you're administering the omeprazole and sucralfate. It does take time to do it properly. In human medicine, at least, giving sucralfate and omeprazole together can inhibit the activity of omeprazole. And when it's so expensive, we want to get the most out of it. So we ideally don't want to give omeprazole and sucralfate at the same time, because that's going to reduce the effectiveness of the omeprazole. So after our fasting that we've already talked about overnight, we would typically give omeprazole first up, and then we would try and wait an hour if we can to give sucralfate, try and give both of those on an empty stomach. Then we would feed at least half an hour later, preferably a little bit longer. And then we would give free choice access to pasture and exercise if that's when you're going to exercise, ideally after both the treatments and after a little bit of fiber in the stomach. And then in the evening we give sucralfate. We can't do that on an empty stomach. We can't give medication on empty stomach twice a day. We're going to do it once a day. So then evening food, and then 10 o'clock or so, we take food away so that we have fasted the horse ready for omeprazole the following morning. So it is really important to remember these things. I know it's a real pain to do, but if you want to get best value for money out of your treatments, it is important to do that. Omeprazole, I've probably said enough about this already. I maybe won't go into this in too much detail, but there's a lot of evidence from human medicine and an increasing amount in equine medicine that omeprazole is potentially more effective than omeprazole, but it's not a registered treatment for horses yet. Injectable omeprazole, again, I've mentioned this a few times. Some of you are probably familiar with it. Again, it's not a registered treatment for horses yet, but it is legally available in the UK. Because omeprazole gets destroyed in the stomach, it's a lot more logical to put it in the bloodstream, but it's been hard to get a preparation that hangs around long enough to be effective. If we put it intravenously, it doesn't last very long. It's a really expensive way of doing it. But if we put it in the muscle in a slow release preparation, it's constantly releasing omeprazole for up to 5 to 7 days, or suppressing acid for up to 5 to 7 days. Increasingly now we use it at a 5-day frequency rather than 7-day, because it seems to work better that way. But it is unlicensed. It has to be prescribed by a vet. Overall, the cost is fairly similar. But there's been a few studies done, which I'll just quickly flick over, just showing that the amount of acid suppression that we get with injectable omeprazole is much better than it is with oral omeprazole. And I've been involved in a few studies. Again, I won't show you all the details, but we've had much higher rates of healing with the injection than we have with the oral treatment. So it's an option to discuss with your vet if you're struggling. And then there's a recent study that I was involved in again that showed that giving it every 5 days was associated with better outcomes than giving it every 7 days. And we had really high rates of healing giving every 5 days, so up in the 90%. So there's more options than there used to be, and there are pros and cons to all of them. It's just something to discuss with your vet when and if you're thinking about treatment. Misoprostol, again, just to touch on that again. Primarily, the reason we're using that is probably to increase blood flow and to reduce acid production. Maybe, I think it's a bit questionable whether it is reducing acid production, and it may reduce neutrophilic inflammation. So the inflammation that we see associated with those neutrophils, that type of white blood cells. Great in theory, but doesn't seem to work brilliantly in practice. This is the important stuff, though. Like, the medication is one thing, but if we want to engender long-term benefits to our horses, we've got to get the management right in order to prevent the recurrence of disease, or hopefully prevent it from developing in the first place. So reducing stress is the number one, and it's easy for me to say and not always easy to do, but just do what you can to try and reduce stress. Try and provide 2 or 3 days of rest per week. This comes from those studies which showed that horses that are competing more than 4 or 5 days a week are more likely to have glandular gastric disease. So try and give them a few days off if you can. Try and minimize changes to riders and handlers. I know, again, that logistically that can be really tricky, but we know that exposing horses to lots of different people coming and going and riding them is a risk factor for disease. Reduce the total duration of exercise as opposed to the intensity of exercise. Turn out with their buddies, compatible paddock mates. Horses, we all know, are herd animals. They like to be out with mates. They don't like to be out with all other horses, though. They don't always gel. That putting them out with the wrong individuals can actually cause them more stress. So it's important that they're out with cohorts or companions that they like. Something else that you can do to help with prevention, and again, this comes with the need for balance against the risk of obesity and laminitis. But oil is not only a good way of getting in calories, like we discussed earlier, as a better alternative than cereal-based feeds. It does actually promote a more healthy gastric environment, done in moderation. Don't get carried away. But 0.1 to 1 ml of oil per kilogram of horse can be a useful way of preventing glandular gastric, or helping to prevent glandular gastric disease, but it does come with that risk of weight gain. So for those horses that are prone to gaining weight, it's not a great option, but it can be an option for some, and particularly those horses that need those extra calories because they're working very hard. Often we give that with vitamin E as well, just as an antioxidant, because we do get more free radical production, which can cause more oxidative damage if we're feeding lots of oil. So antioxidants can help offset that. So monitoring the response, I've said it a few times already, at risk of getting boring. It is really important that we follow up, and we're honest, and we check how well horses have responded to treatment, particularly with glandular disease, where our rates of healing are nowhere near as good as we would like them to be. Sometimes with some treatments, not even more than 50% healing after a few weeks of treatment. So we do need to be honest about that. Duration of treatment is difficult to predict. So typically we would rescope them monthly, and we hope that they're healed after a month. That's what we're all aiming for. But sometimes we do need 2 or 3, or potentially even more, hopefully in a minority of cases, cycles of treatment to get where we need to get to. And I think it's important to have a plan and not just chop and change treatments, but that's more, the onus is more on your vet than it is on yourself. And if there's been no improvement after 3 months, then we have to look again. We have to think potentially about biopsying the mucosa. We have to think about potentially what else is going on here that we're missing, that might be driving the underlying issues. Nutraceuticals and buffers. I tried naively once to go through all the studies around different nutraceutical and buffering products to try and come up with some rational recommendations. There are so many of these different products and so many different studies, often with slightly conflicting results, that it's really, really hard to make good sense of it. A lot of these nutraceutical and buffer products will have a useful adjunctive effect in neutralizing acid or lining the stomach. Very few of them have any data to show that they're effective in healing these lesions, but they might have some slight benefits in preventing them from developing in the first place or preventing them from coming back. But in terms of value for money, often they're not great because there's a marginal gain and they're often quite expensive. Again, I would advise you to speak to your vet specifically about different products, because there is an awful lot of witchcraft as well. There's an awful lot of false claims on different products, so just be a little bit careful. But there are products out there that can be helpful, and I'd be looking particularly for products that have got things in that have got evidence to support their benefit. So calcium, psyllium, pectin, lecithin, probiotics and prebiotics, and antioxidants all have scientific evidence to demonstrate that they can be beneficial. So I would look at those kinds of products, or products that got those in, and often these products are a mix. So just to sum up, horses suffer from at least 2 different gastric disease syndromes: Squamous disease and glandular disease. And it's important for us, more than for you, I guess, to identify which of those is the problem and to act accordingly, and to tailor treatment and to advise you on management according to which is developed. The only way to diagnose them is with gastroscopy, so putting a camera down into the stomach. There's lots of other tempting ways, but they just don't work, I'm afraid. And then we need to tailor treatment to your specific horse, make sure it's followed up appropriately. Oral omeprazole is the mainstay of treatment. I'm sure everyone's familiar, or many people are familiar with that. Make sure you follow the instructions around feeding, though. It's expensive. Make sure you get value for money by following the recommendations around fasting prior to treatment, around not giving at the same time as sucralfate if you're giving sucralfate. Try and give it before you feed and then before you exercise. So try and get that routine right. If you can't get it right and it's not working, then there are alternatives. The injection is the easy way of getting omeprazole in, albeit it comes with other potential disadvantages. For glandular disease, it's more complicated. For squamous disease, we tend to get on fine with omeprazole. For glandular disease, we often have to use more different options: esomeprazole, injectable omeprazole, misoprostol that we talked about, and then the addition of sucralfate, pectin, lecithin may be beneficial. But the treatment is one thing. The fundamental issue is trying to get the management right, trying to trickle feed to forage, trying to reduce stress in the environment, trying to replicate a more natural environment for the horses that you're looking after. Long-term management is infinitely more important than short-term treatment. So the vets here are just the bit players. It's down to you guys really to make the fundamental differences to prevent the disease developing and prevent it coming back. So I think that's me, Alana. I hope that was okay. I hope that was what I was supposed to talk about. Happy to take any questions.
Perfect. No, thank you very much for that, David. That's been, yeah, the time went so quickly. So yeah, I think we've all learned a lot about equine gastric disease, as we shall now all be referring to it. I have a few questions for you, and I know that there's quite a few questions coming through on the Zoom Q&A tab. So just to remind everybody, now's your time if you have a question for David about any gastric disease questions, put them on the Zoom Q&A tab. And if you're on the Zoom Q&A tab, can you please upvote any of the questions that you really want to be asked, because we might not get a chance to get through them all, and that gives us a chance to do the one. So yeah, as I say, I'm just going to get the ball rolling, David, if that's okay, with a couple of
Yeah, yeah.
questions. So yeah, so you have covered some of this, but really just to bring home this message that if owners could make one simple change to prevent gastric ulcers from developing in the first place, what do you think that one change would be or should be?
Oh, I'm only allowed one. Reduce stress.
History.
Constant access to forage. I've had two.
That's fine. And one of the things I think, if you look back at a lot of our webinars, that any of the sort of pretty much any of the management sort of webinars around horses, it is all around those three Fs, the sort of friends, forage, and freedom, and actually just providing them to your horse can make such a massive difference to their quality of life. So if there's another question, if a horse is swinging around to bite you when they're doing up the girth, is this always going to be a sign of ulcers?
No, definitely not always. It can be an indication of ulcers. There are neurological pathways whereby horses that have got sore stomachs are more sensitive over their flanks, and I think that's where this comes from. But there's plenty of other reasons as well. Some of them just don't like having the girth tightened up, and other reasons, associations with competing if they've got other signs, or riding if they've got other signs of pain, just that negative connotation around what's about to happen next potentially. So it's worth considering gastric ulcers, gastric disease, but there's loads of other reasons too.
And sort of saddle fit and everything, and it's probably a sign. Are we reasonably confident it's going to be a sign of pain? It's of some description. So probably to speak to your vet, would that be?
Yeah, I think so. I'm not. I don't know. I might get shot down. I'm not sure it's always a sign of pain, right? Some horses just do it, but I would certainly want to rule out there being a source of pain as best you can.
And then my final question before we move on to our audience Q&A is like, if you have ever had a horse that presented with abnormal clinical signs but discovered ulcers were the problem.
Um, yeah, yes, yeah. I did used to look at all the weird and wonderful, but yeah, well, there are so many different clinical signs. I had one horse present with really odd neurological signs, and thought for all the world it had neurological disease, but it actually just had a really, really, really sore stomach and a really, really hideous glandular area of disease. I think it's probably more likely the other way around, that we often get presented with horses that people think have got gastric disease, but the fundamental problem is often not gastric disease. It's often a sore back or a hind limb lameness or a forelimb lameness. But I would, I predominantly worked in referral hospitals, and I would always try where possible, particularly if I've not found anything. But even if I had, I would try and get one of my orthopedic colleagues to also look at these horses to see whether there's a sign of orthopedic pain as well, because I think that, again, that can be, it's not been found in studies, which I've always found odd, but if you've got horses that have got pain, then clearly that's going to be associated with stress in my book, and if they've got orthopedic pain, I think that's a risk factor for secondary gastric disease. So we want to get to the underlying cure, as well as fix both problems for the horse.
That makes sense. And is there like a right and a wrong, or is there a certain thing that you would tend to check first, or it would just be depending on clinical signs, whether you're going down an orthopedic route or a sort of internal route?
I think so. Clinical signs, and also a degree of pragmatism and what works best logistically. Yeah, I think it depends a bit on the horse.
No, thank you for that. Okay, so as I say, we've got quite a fair few questions coming in now, so we shall start and hopefully get through as many as we can. So the question here from Stacey that says, "What's your thoughts on feeding top spec ulcer kind? This has come recommended by a veterinary member of staff."
Uh, I'm not familiar with all the pros and cons of all the different brands of products. If it's from a reputable manufacturer, then I'm sure it's going to help. But I guess my question always is whether you need those additional feeds as opposed to just a good quality forage, plus or minus, well, plus invariably a vitamin mineral balancer from one of those same reputable companies. But I'm not sure they always need the feed component. If they're on a good quality forage, and ideally you've had it analyzed, which is only 20 or 30 quid, so you know what you've got, then they rarely need additional feeds. Like, everybody's become habituated to giving horses a bowl of food in the morning and a bowl of food in the evening. They never evolved to do that. They don't need that. Most of them are overweight anyway. So I would just question the need for the extra feed, really. But they do, particularly if you haven't had your forage analyzed, they do need some kind of vitamin mineral balancer just to make sure they're getting everything they need. But it literally just needs to be that. It needs to be a supplement rather than a feed.
That's a good message.
At risk of getting hate mail from all the feed companies.
There's a message here from Tomomi, who's saying, is there a specific type of hay you would recommend to better manage or prevent gastric disease? And could you please repeat what should be fed in the morning?
I think generally speaking, you want a low sugar hay. So a hay ideally made from a native grass. Timothy hay is great. But again, this is where the analysis comes in, because you don't really know what you're getting unless you analyze it. But yeah, just a low sugar hay from native grasses. And in the morning, it's slightly different, I suppose. And I was focusing more on treatment rather than just prevention. And it's different. If we're treating and we're giving omeprazole, then the point I'm trying to make is you want to get the most out of your omeprazole, and you want to fast the horse overnight, and you don't want to be giving the omeprazole on a full stomach. If you're not treating with omeprazole, then it doesn't matter. Then you want them to have access to forage as much as possible. But you want omeprazole on an empty stomach. You don't want sucralfate going at the same time as omeprazole if you're using it, and you then want forage after the horse has had time to get the omeprazole through its stomach, so at least half an hour, maybe a bit longer. And then you want your forage and your omeprazole an hour or two before you exercise to neutralize the acid in the stomach as much as possible when it splashes around, and to make sure you've got forage in the stomach when the horse is exercising to just physically stop that splashing. Does that make sense?
Yeah, that makes perfect sense as well. And it is, as you say, it's just trying to get that routine in place, isn't it? I see a few questions coming through in the chat function, so can I please just please use the Q&A tab so we can get to your questions. There's a question here from Catherine that's saying, if EGGD was not treated with medication, would the ulcers heal naturally by themselves if the management was then ideal?
That's a really good question. We would have said until recently, generally no. However, there was a study done recently which did show that a proportion of them did heal on their own, which makes sense, really, because most things, given enough time, and will heal. The body's pretty amazing. I guess the fundamental thing is whether we can change the management to eliminate the risk factors, and if we can, then I think they certainly, some of them will heal. But the conventional wisdom is that they really do need acid suppression to give that mucosa the opportunity to repair. So I guess it depends a little bit. If the horse has got clinical signs, then it would seem remiss to me not to be treating them. If the horse clinically is absolutely fine, then I think you can probably just see how it goes a little bit if you can make the management change and not necessarily dive in with treatment if it's a struggle to do so.
I suppose with all these things, it is about sort of obviously prevention being better than cure. So if you can get the management right before you have any issues, would be our main aim, isn't it?
Yeah, absolutely.
And this is another one from Tomomi, but very interesting. Why does fasting overnight not cause ulcers, but fasting in the daytime does?
That's too difficult a question for me. That's in the too hard basket. There are physiological mechanisms, but I can't remember what they are. But it does make evolutionary sense, because in that period of time, they would typically have just chilled out and slept in the early hours of the morning. And yeah, I can't remember the reasons for the rhythm in acid production and why that happens, but the horse's stomach has evolved to produce more acid during the day when they're eating and less at night, which is why it's less of an issue.
I think from your slides, it was sort of from about 10 at night until about 7 in the morning. So we're still actually getting a lot of hours of daytime eating in amongst that 24-hour period, isn't it? So it's not, although it's fasting overnight, actually the vast majority of that 24-hour period is still with access to forage.
Yeah,
And there's one coming in from Facebook from Chloe on Facebook that says, I often hear people talk about hind gut ulcers. How do these differ from squamous or glandular ulcers, or is this the same as the glandular portion of the stomach?
No, it's not the same. This is always a difficult question to answer because there isn't much science behind the presence of hind gut ulcers, but there's an awful lot on Dr. Google about hind gut ulcers. And it's obviously something that is very prominent in a lot of horse owners' minds, but it's not something that is that prominent in vets' minds because we don't see it as being a big problem. If you've been unfortunate enough to have looked at lots of horses in the abattoir or to have read the studies where they've done that, you don't find many horses that have hind gut ulcers. There's been a couple of studies in pretty unique management settings where they have found a reasonable number of horses that have had disease in their hind gut. But really, in the kind of horses that we're all dealing with, it's incredibly rare. And no one can ever prove that a horse has hind gut ulcers other than, unfortunately, after it's passed away. Despite what is said and the fecal tests that are out there and the other stuff that gets said, there's just no science behind it. And there's no science behind any of the treatments for hind gut ulcers as well. So a lot of cynical members of the veterinary profession would think all of this is a bit of a money-making ruse, if I'm honest. The difficulty for us is it's very, very hard to disprove that a horse has got hind gut ulcers because we don't have any tests to prove one way or the other. But there's just no real rationale for it, and it is totally different from either squamous or glandular ulcers.
Yeah, it's very interesting because it definitely is something I've read a lot about, as you're saying. Maybe it is the Dr. Google, but about hind gut ulcers. So it's really interesting to hear that coming from you. So there's one here from Sandija who's saying, can omeprazole or esomeprazole be used for pregnant mares, and can some of the signs be confused with pregnancy? So some of the signs of ulcers, could they be confused with pregnancy?
Yeah, I guess so. If pregnant mares are generally uncomfortable, that could be confused with some of the signs of abdominal discomfort. And yeah, they can be used in pregnancy. They're very safe.
And there's another one from Facebook we've got. Nice to see some good Facebook ones going through. So from Jessica, so do you find generally there's a correlation between the new way of managing and feeding horses, overfeeding, processed hard feeds, less access to forage, stabled for long periods, supplements, etc., as opposed to the old ways of the horses living out, access to hay and grass, and feeding non-processed straights and chaffs? Or do you think we have just more medical advances now to discover ulcers? So
I think I understand the question. So the epidemiological studies that have been done, so the studies that have looked at risk factors for gastric ulcers, have consistently identified that more intensive management system with more supplementary feeding as being a problem. So I think we're being very general, aren't we? But going back to the old way of managing them out and not feeding them large amounts of processed feed versus grains, I don't think is going to make a huge amount of difference, to be honest. I don't think whether it's raw or whether it's processed is a big deal. The processing, I think, is not a big factor. It's more the fact we're giving large amounts of sugars and starches, which then they don't cope with that brilliantly because it stimulates acid production. So yeah, getting back to a more natural routine is definitely the way forward.
Actually, definitely coming through loud and clear that, yeah, as natural as we can be with them. There's another one from Sandija that's asking, can a scope and treatment medication be done? Can it be done? Can you scope and treat a pregnant mare? You've kind of answered this one already, I think. But yeah, that's you can still scope, no problem. Okay, another one from Catherine. I say another one. Have there been any studies showing that hay is better than haylage for horses prone to EGGD or for horses with ulcers?
It all depends on how they're produced and their relative nutritional content. Hay, one would generally think, would be slightly better, but really it doesn't make a lot of difference. So yeah, again, it comes back, ideally get it analyzed so you know what you've got and what you're dealing with. Otherwise, we're all guessing, really. But yeah, it's more about what's in it and the quality and how well it's been made, rather than whether it's hay or haylage per se.
As you say, but for most of our horses, we actually want sort of that lower nutritional value, don't we, of some form of forage going through there. their systems.
Yeah, but yeah, absolutely, dead right. And generally speaking, that would be slightly over haylage, but it's not black and white that haylage is always going to be better in terms of nutritional content and therefore worse for most of our horses. It's not that clean cut. So yeah.
Here's one from Kathy. She's saying she's currently on day 4 of treatment. Her pony's not very keen, sorry, on the is it the sucralfate
Yeah.
syringe to the taste. Is it okay to add a bit of mint to make it more palatable, or will this interfere with the efficiency of the medicine?
Can't see that being a problem. But if you are really struggling, speak to your vets because there are different strategies. But yeah, a little bit of mint, I don't think it would be a problem.
There's one from Nicole here. So she's saying, has there been any research on the use of coated omeprazole granules in the prevention of the disease, and specifically the glandular type, from which my understanding is less responsive to the omeprazole?
There have been studies. Obviously, to get a product registered, you've got to do a reasonable body of work. So that's been done for the registered granule product that's available in the UK. There are other granule products that are available elsewhere in the world as well that have also been subject to study. The granular products in principle are really good. I struggle with them slightly in that they're often advocated, or whether they're advocated, people often end up giving them with food, which can be slightly counterproductive. That can negate the benefit of encapsulating the omeprazole in a granule. But unfortunately for glandular disease, they don't make enough of a difference. So oral omeprazole for glandular disease, 25 to 50% healing, looking at the different studies that are out there. So generally pretty low. And unfortunately, the coated omeprazole. To be fair, there haven't been any specific studies that I could think of looking specifically at healing rates on, or only very small studies. Actually, there are some, but they're only small, looking specifically at healing rates on glandular disease. But there's no reason really to think that they would be more effective than the buffered preparations. It's just a different strategy for getting omeprazole through the stomach. And we know from the graphs that are produced off these different drugs what concentrations we tend to see with the different drugs. And the coated preparations are pretty similar, particularly as they tend to get given at a lower dose rate. So we get the same levels of omeprazole in the blood. So we're not going to get better rates of healing with glandular disease, unfortunately.
Okay. There's another one from Sandija, but she did write it at like 7:20 before you'd gone through your presentation about what the ways to how to treat and manage gastric diseases. But so I think we'll skip over that one because your presentation has very nicely outlined all that. There's one here from Facebook from Maria that says, I learned that it's beneficial to give some hay just before riding. This would prevent acid rising and acting as a kind of block when exercising. Is this true?
Yep. Yep. Everyone should do that.
I think you mentioned was it a couple of liters of hay or chaff or
Yes.
something? Yeah. Perfect. There's one here from Alison saying, my horse witnessed an accident where his buddy was killed. He stopped eating for about 6 weeks, other than grazing lightly and picking at some hay. He was scoped and diagnosed with glandular ulcers. Glandular ulcers, sorry. To diagnose, he had to go to the vet clinic overnight. He was super stressed with the process and very anxious afterwards. He was treated with Gastrogard and Sucralfate. He had finished the treatment and his symptoms have much improved. I'm very, very nervous of putting him through a visit to the clinic again because it will to trigger the stress and relapse. Is there any advice you can provide?
Yeah, can they not scope on the yard? The risk of making myself unpopular with the vet's concerned. Yeah, mobile gastroscopy is pretty straightforward. So they could come to you. You still have to fast the horse overnight at home. But I think particularly with glandular disease and with omeprazole and sucralfate treatment, which isn't always amazingly effective, I think it would be good to check that their lesions have improved, hopefully healed. But I understand your reticence, and if the horse is doing really well clinically and you're really happy, and hopefully he's getting through that tough time that he's been on just with time, then yeah, I can understand why you wouldn't necessarily want to.
But perhaps, yeah, speak to her vet to see whether they can actually carry out that at her own yard to avoid
Yeah.
that extra stress. Yeah. Yeah, and I think sorry, this question is saying the question from Alison, which has obviously come through, but she's saying, should I rescope? we obviously don't know what's in relation to, but your presentation has obviously talked about rescoping a lot, haven't you? You kind of said don't skip that stage.
Yeah, you get because otherwise you are. I can understand why people want to, but you're guessing otherwise. And the last thing you want to do is invest all that money and not get to where you wanted to get to, and then have a relapse and be back where you were and starting again and spending more money. So yeah, otherwise it's a shot in the dark really whether your treatment's working or not.
Okay, there's another question here from this one from Natalie, but it's about hindgut ulcers again. So as you can't scope hindgut ulcers, do we just have to look at the symptoms and treat them? Does omeprazole actually work in this instance?
No, omeprazole is not going to work, but I would question what the symptoms are, and I'll question whether they're really related to hindgut ulcers.
One from Alicia here, sorry. Does good long-term management negate the need for treating any ulcers
I
present?
guess that's
Sorry.
similar to the question earlier as to whether they get better on their own, and some of them may, yeah. Um, but generally speaking, we would still want to try and get rid of them as quickly as we can for the horse's benefit. But as we said earlier, sometimes if the horse isn't suffering clinically and isn't showing clinical signs, you might be a bit more pragmatic about it.
I suppose if it's looking at the management of the horse will lead you to whether like how likely ulcers are going to be as well. So if you have a horse that lives out and maybe doesn't, have much, lives out in a herd and maybe isn't ridden or something like that, you might not get to ulcers might not pop up your potential list depending on what the signs are, versus a horse that's maybe out competing a lot where you might jump to that conclusion a bit quicker. Would that be fair to say?
Yeah, I think so. Yeah.
Yeah. Um, so if there's a one here from, oh, actually, this is almost quite similar for Alicia that was saying, so what's the evidence for fasting before omeprazole? I thought recent advice was that it isn't necessary. And do you ever treat field kept horses? And if so, how were they fasted?
There's been 3 studies I can think of that have shown a dramatic difference in the absorption of omeprazole between horses that were fasted and not fasted. So you get much higher levels in the blood, so you get much more effective acid suppression if they are fasted. There was some recent work that was done looking at one of these granular products where the omeprazole granule was given in a small amount of chaff, but really, I'm talking a couple of handfuls, if that. And I think some people have misinterpreted that and said that that drug worked okay, and therefore we don't need to fast. But I think that it's wrong to extrapolate in that way. So the evidence is pretty clear that they will respond much better to treatment if they are fasted. That's
Thank you.
that's sort of the problem I have with adding omeprazole granules to food, is that it's counterproductive.
There's a question here from Eloise asking if the horse is underweight and suffering from ulcers, are there any feeds that you would suggest to help them?
No, not specifically. Other than the principles that we've outlined, just good quality forage, and oil if they need the extra calories.
When you mention oil, are we just talking like a vegetable oil or any particular type of oil?
Yeah, good question. Sorry, I should have said that. Doesn't really matter. Linseed, flaxseed oil tend to be the most palatable to horses. They can be more expensive though, but they would be good. They've got a good balance of omega-3 versus omega-6, so they're less inflammatory than some others, but it doesn't really matter.
There's one from here from Carly asking, do we then feed chaff with a balancer or just a balancer? If we're talking about just trying to get that basic sort of vitamin and mineral ration to them.
Again, at risk of getting more hate mail from the feed companies, chaff is just short chop hay, isn't it? Like it's just a very expensive way of giving them fiber and forage. So by all means crack on with the chaff, but much cheaper to feed them forage. So it's the balancer they need for the vitamins and minerals.
And as you say, if you can get your actual hay analyzed, then you'll know what you need to be topping up with as well. There's one here from Sue saying, do we have to wean the horse off omeprazole gradually to prevent a rebound of the acid?
No, that was something that was debated, but there was some research recently that showed that we don't see a rebound effect in that way in horses. So it's not something I would worry about.
Okay, thank you. And there's another one from Sue here that's saying, I've read that feeding alfalfa helps treat ulcers. Is that true?
There was a study recently that did show that, actually. It was in standard breds in France, so you could question quite how relevant it was to the way we keep our horses, perhaps. But yes, and it's logical too, because it's quite high in calcium, as well as being a good source of fiber. So I wouldn't necessarily go out and spend an absolute fortune importing alfalfa rather than feeding grass-based hays, but yeah, it does help potentially.
And there's a Sandija has asked, but is feeding homegrown oats good for horses that might be prone to gastric diseases due to competing?
No, I wouldn't be a fan of that. Whether like we said earlier, whether it's processed food or whether it's raw cereals, they're still going to be high in sugar and starch. So oil would be a much better way of getting the calories in if they're competing.
I actually think there's Sandija has asked something else about a kind of supplement, but there's a link that I'm not clicking on, I'm afraid. So for fear of what it might do to my computer, I'm sure it's all legitimate Sandija, but if you want to put the name of the product in rather than a link, then I'll ask David. But I think though we might have got through our questions, David. So what I will ask you, let me just have a quick scan back through because I think we've done it. Pregnancy. Yeah, we've got through them all. So, what we normally ask as well is that if you have an you've brought home lots of really nice points, but would you be able to like kind of sum up in maybe like three key take home points for our audience today to take with them about sort of equine gastric diseases?
Reduce stress, constant access to forage. Speak to your vet if you're worried.
There we are. And I've just got a little bit of before I say thank you very much, which this has actually been I've been a really super presentation. I want to just take this opportunity just to remind everyone that if they would like to email us any future suggestions for some webinars, the email address to do that is education@wildhorsewelfare.org. And as I say, once again, David, a massive thank you to you for everything you provided us tonight. And as I say, like it's just really nice to see, I think, from all of our presenters how sort of joined up all this, particularly all the preventative information is, regardless of say if you're talking about dentistry, sort of the horse's mental well-being, or in this case, gastric diseases. A lot of the key messages are just singing loud and clear through about that reducing the stress to the horse, as natural life as possible, giving them some friends and lots of forage. So thank you very much for that, David. And just I want to quickly just remind everyone about, just so Basil can get this link in before, that we're having our next webinar on Wednesday, the 13th of March, and we'll be joined by Dr. Emma Lethbridge to discuss trauma in horses. And just to repeat that she'll be joined by by equine behaviourist Justine Harrison, and they'll be both on hand to answer your questions. Perfect. Okay, well, thank you very much, David. It has been a pleasure, and I hope you'll take us up another offer in the future to come back and speak to us again.
Well, yeah, very happy to. Thank you very much for having me. It's always nice to work with you guys. Thank you very much.